Hello everybody, namaste. From the VP platform, we have already discussed about many of the psychological topics. As we are doing it sessions wise, it is based on the degree and PG syllabus, but on demand. So we thought, and many of the students have asked about to do the video about the different disorders of like psychological disorders. So we thought of starting it with the schizophrenia. So schizophrenia is one of the major mental disorder. Okay, it is considered at the top compared to all other psychiatric disorders. It is at the top because the effect of schizophrenia is so much. That's why. So firstly, in this video, we'll be discussing about meaning and definition and the survey report and symptoms, causes and the treatment. Okay. So firstly, the meaning and definition. Schizophrenia is a split of mind. So mind is a cognition. Okay. So cognition consisting of our perception, our thought process, our language, our behavior, attitude, aptitude, and our reasoning capacity, questioning capacity, answering. So all these things is the combination of this is called as cognition. So in schizophrenia, these cognition is scattered into different parts, so which is not connected to each other. So that's why the person who is having schizophrenia will behave abnormally. Okay, even I have mentioned abnormal behavior. So that means just a layman can understand this person is not well. Okay, just looking at the schizophrenic patient, a layman can understand because his behavior will not be like a normal person, and there will be the mind will be scattered into different parts. As I already said, it has no connection among them. There will be loosening of connection and improper emotions and the feelings. So feelings will not be properly organized. There will be improper feelings, improper emotions. They will present their emotions in a different way in a different situation. Actually, when you go to birthday, we will be happy, we'll be enjoying, it is a happy mood. Okay, but at times when a schizophrenic patient goes there, he may cry, he may shout, he may show anger. Suddenly there will be shift of their emotions. So it happens because of the disease condition. And also there will be disturbed thoughts and perception. The thoughts will be disturbed, there will be abnormal way of thinking, and also the perception, the way they look into a word, the way they listen to things, the way they see things will be disturbed. Okay, and there will be unrealistic ideas also. So they'll not connect themselves to the reality, so they think something else, they think something which is not actually present. Extra thinking, extra way of perception will be there, so which are not realistic. Okay, so these are the meaning of and definition of a schizophrenia. So according to survey report, whether the schizophrenia is more among male or female, so the survey report proves that it is equally divided among the males and females. There are few psychiatric disorders which are more among males, which are less among females, which are more among females, which are less among males. But in the schizophrenia condition, the survey reports that this is equally divided. 50% of males or 50% of females will suffer from schizophrenia, and it runs in heredity. So it is like through the genes there are chances of a person getting a schizophrenia, and also it runs among the twins. And if parents, among the parents, if one parent is having schizophrenia, there is a maximum chances of a child also getting a schizophrenia. If both the parents are schizophrenic, yes, the chances will be more. Okay, so it runs among the genes. That's why it proved that among the heredity, like if a maternal uncle, if a parents, if a we can say grandparents have a schizophrenia condition or mental illness or any of the psychiatric disorders, there are chances of a first generation or second generation getting the disease. So we'll see the symptoms now. So symptoms majorly there are 5 major symptoms like delusions, hallucinations, catatonic behavior, disorganized speech, and the negative symptoms. Schizophrenia or any of the psychological topics are very vast to explain. It has a lots of things to explain. So I cannot cover everything in a 5 or 10 minutes video. So we thought of explaining you each one in detail in different videos. Okay, this is today's video is just a simple introduction for you to know about the schizophrenia, but regarding delusions, regarding hallucinations, negative symptoms, we'll be having separate videos too. Now I'll explain you delusions. Delusion is purely related to thought process. Okay, it is about our thought, the way we think. Okay, in delusion we have different types of delusions. So preferably or generally delusions where the schizophrenic patient think that others are looking at him, others are laughing at him, others are talking about him, others have done black magic on him, others are poisoned his food, okay, others are following him, trying to harm him, or marital partner is not a genuine person, he may be having extramarital relationship. So these are the regular thoughts of a schizophrenic patient, so that is called delusions. Then he will be having hallucinations too. Hallucinations are purely related to our sense organs, okay. Here in hallucinations it is related to perception, okay, it is considered as abnormal perception, where in hallucinations schizophrenic patient feels that God is talking to him, he can hear the voice of God, he can see the God, he can see the dead person, he can hear the voice of a dead person, okay, and he feels that the food is tasting like a poison, okay, he can smell, he can inhale a poisonous gas, he can feel something crawling on his skin. So all things related to sense organs, like he can hear, he can see, he can sense, he can smell, he can taste. So all these five types of abnormal perception he will be having, that is called hallucination. Then he will be having catatonic behavior. Catatonic behavior is like having a very rigid movements. He will not make a proper flexible movements. He will be maintaining a same posture for a long period. Maybe sitting posture, maybe standing posture, maybe sleeping posture. Okay. So all of a sudden he gets a thought like he should stand there. He will be standing there only. Maybe for 1 hour, maybe for 3 hours, maybe for half a day. So till he feels like getting relaxed. Okay. That is catatonic behavior. So being like a statue. Next one is disorganized speech. Again, I said disorganized thoughts, that is delusion, disorganized perception, that is hallucination. Now, disorganized speech, having a problem in a proper conversation, so that is disorganized speech. Okay, then negative symptoms. Along with these four symptoms, he will be having negative symptoms too. Negative symptoms are those which a normal person can do all the activities, the daily activities of him very normally without his conscious also, but this person who is having schizophrenia cannot perform those normal activities in a normal way. They'll be lacking of these activities like poor personal hygiene, poor social interaction, poor emotion, poor motivation, poor judgmental skills. So these are all poor or lacking of a normal activity, that is called negative symptoms. So these are the five major symptoms of schizophrenia. On these each symptom we'll be having separate videos too. Causes. So the causes of schizophrenia is firstly heredity. It runs in the genes. So as I already explained, maybe from a first generation, maybe from the second generation till the third generation, it runs through the genes. Okay, chances of getting a person schizophrenia or many mental disorder, maybe because of his parents if they are having a disease condition, maybe because of their grandparents, maybe because of their paternal aunts, paternal uncles, maternal aunts and maternal uncles. Among the blood relatives, there are chances of a person getting a mental disorder if there is a family history of mental disorder. Second one is a biochemical imbalance. Biochemical is also called by different another name, that is neurotransmitters, which are present in a brain. It is in a liquid condition. Okay. So neurotransmitter or a biochemical variation. Everybody has these neurotransmitters. Everybody has their biochemicals. There are different types of biochemicals, but secretion of a biochemical varies from person to person. If over secretion also leads to mental disorder, less secretion also leads to mental disease, mental disorder. So here in schizophrenia, dopamine is one of the biochemical. More secretion of this dopamine leads to schizophrenia. So we give a medication to decrease the secretion or make a secretion normal. Okay, production of that dopamine, to make normal we give a medication. That's why after a medication the person will be becoming all right. After some time, because of the medication he'll become all right. Okay, because the dopamine content will be decreased because of the medication. So along with heredity and biochemical imbalance, there are other reasons also which contributes to make a disease condition severe. That is psychological factors like being depressed because of anxiety, because of stress, because of frustration, because of over anger, and also social factors like poverty, unemployment, family issues, death of a loved one, that also contributes. It is, I'm not saying that these reasons leads to schizophrenia. This will contribute to mental disorder, but major reasons of any of the mental disorder is heredity and the biochemicals. Now we'll see the treatment part. Under treatment part, the first thing is medication. As I already said, it is because of increased dopamine secretion. If I sit and talk to patient and counsel him, that doesn't mean that I can go inside the brain and I can change the dopamine secretion. So we need medication. Okay, so medicines are very much important. Going to hospital, contacting a psychiatrist and taking a medication is really important to control the psychiatric disorder, to get over from the symptoms. Second one, counseling. So in counseling we have different types of counseling, and for all the counseling thing we have a different slides, different videos too. So counseling, individual counseling, group counseling, everything we do to make a patient proper. And even psychotherapies will be there. Even on psychotherapy we'll be having different videos, we'll be releasing the videos too. So psychotherapy is given, or it is a kind of treatment given for the psychological disorders, and along with that we have yoga and meditation also helps to overcome these symptoms. Okay, hopefully it is very useful for all the students, all the persons who want to know about the mental disease, and even for a general public it will be helpful for you if you have anybody like this at your home. So you can make out that these are the conditions where you have to go. You can go to a psychiatrist, to the hospital for the treatment. If you find it very useful, please subscribe to this channel for more and more interesting topics. Thank you so much.